So in 2012, I was diagnosed with grade 4 endometriosis following a laparoscopy.
Endometriosis is the ectopic implantation of the inner layer of the uterus or endometrium in different organs. If it is implanted in the uterus, in the wall of the uterus, we call it adenomyosis. But if it is implanted in the pelvis, bowel, bladder, lungs, eyes, brain, it's called endometriosis. It can affect 10% of women around the world. And it takes up to 7 to 10 years for this condition to be diagnosed.
I've been a midwife and a registered nurse for 16 years, and when I was diagnosed with endometriosis, I was quite naive. I didn't know much about it, and I kind of felt like if I had a surgery, it was gone and it's fixed.
The symptoms of endometriosis can include painful intercourse, painful periods, abnormal bleeding, bowel dysfunction and urinary dysfunction, as well as infertility. Endometriosis can be superficial or deep infiltrating endometriosis. This stage of endometriosis does not correlate with the symptoms. With some very mild symptoms, people could have bad symptoms, and with severe endometriosis have no symptoms.
As an endometriosis sufferer, I've had a substantial amount of symptoms, anything from headaches, tiredness, extreme bloating, to the fact that I look pregnant. Particularly one of my bad symptoms has been revolving around my bowel. A lot of people don't know that endometriosis can occur outside of the uterus and affect other organs, and for me, the bowel symptoms were quite severe. I would get diarrhea, constipation, and a lot of pain. I would get blood in my stool, lots of mucus. Another symptom that I had with my endometriosis was infertility. I was in a long-term relationship with my fiance, and I never got pregnant in that whole time of nearly 11 years.
Endometriosis can affect fertility in different ways. One is creating an unfriendly environment for the egg and sperm to be fertilized. The other thing is that it can interfere with tubal function and interfere the transfer of the egg to the womb. And when the embryo is transferred to the womb, it can interfere with the implantation of the embryo. Management of endometriosis can be medical or surgical, but by the time the patients are referred to us, they have exhausted all the non-surgical management. Surgical approach should include a multidisciplinary approach and often includes physiotherapists, dietitian, gynecologist, and in case of bowel or bladder dysfunction, also colorectal surgeon and urologist. Endometriosis management needs to be tailored to the woman's stage of life. As a surgeon, we want to cut out the disease and eliminate the pain for the patient. But the patient might be happy to put up with a bit of pain and bleeding as long as they can preserve their fertility. This involves preserving the uterus. If there is hydrosalpinges, it means water or presence of pus in the tubes, removing the tubes and preserving as much as possible the ovaries or the ovarian tissue and not affecting the ovarian reserve for the woman. A woman should be able to seek second, third, fourth opinion if needed until she feels that she is understood and listened to, and the plan is tailored according to her needs.
I'm really grateful that I had access to minimally invasive robotic assisted surgery. I'm glad that I've been an advocate for my own health. I still have my uterus and have a chance of having another baby.